State Representative Jill Schupp. I'm the Minority Caucus Policy and Member Engagement Leader. Due to the comments of one of Missouri's U.S. Senate candidates, there has been a lot of discussion and frankly a lot of misinformation about women's reproductive health lately. This lack of basic knowledge about women's bodies and the reality of women's lives, our lives, offered up by Congressman Todd Akin's outrageous statement, is also laid bare by Senate Bill 749, Missouri's birth control refusal bill, wisely vetoed by our governor. Like Todd Akin, supporters of Senate Bill 749 simply turn their backs on basic facts about how birth control works versus how pregnancy occurs in women's bodies. Like Todd Akin, supporters of this bill simply don't seem to care that forcing women to pay for preventive health care in the form of birth control on top of our monthly premiums will have a significant economic impact on Missouri women and our families, particularly women in lower income families. Well, I'm here today to let Congressman Akin know and to let supporters of this bill know that the only thing that can legitimately shut down a possible pregnancy before it starts is birth control, and that a woman, not her boss, not her insurance company, is the one who should be making health care decisions about birth control and sterilization. Let's address some basic facts. First, this bill has nothing to do with abortion. We know that this bill is an attempt to undermine the incredibly popular provision of the Affordable Care Act that requires most health insurance plans to cover birth control, not abortion, as preventive care with no additional copays. Current Missouri law prohibits insurance coverage for abortion unless purchased as a separate rider. End of that story. Second, birth control is basic health care and is an economic issue for Missouri women and families. The average family of 4 with employer-based insurance is already paying 10% of their family's income in health insurance premiums, and that number continues to rise each year. To make women pay out of pocket for birth control on top of premium payments has real economic consequences, with birth control costs ranging from $15 to $15 a month. What does that mean? Well, that's the equivalent of 5 weeks of basic groceries for a family of 4, or 14 tanks of gas in the minivan, or 4 hours of tuition at a community college. There are some people in this state and in this building who are willing to play politics with women's health. I am not. These are real issues and have a real impact on women's lives and families' well-being. Just look at what this bill means for a family living paycheck to paycheck. Imagine the impact as they might have to make a choice between birth control and groceries. This, to my right, is what a week of groceries looks like for a family of 4. We're talking about fruits and vegetables, we're talking about pasta and bread, cereal, we're talking about sauces to make dinner dishes, we're talking about peanut butter to provide protein, and cheese for nutrition. That's the difference here between what paying for birth control will do versus paying to feed a family of 4 for 5 weeks. This represents healthy food for our children and, of course, business for our local grocery stores. Working women in 49 other states can access birth control with no additional copays. For the sake of working women in this state, this legislature should step up and sustain the governor's veto of this punitive and, pardon the expression, ill-conceived legislation. Thank you.
Thank you, Representative Schupp. I'm Mary Still. I'm State Representative in Columbia, Missouri, District 25. Senate Bill 749 makes it harder and more expensive for women to get contraception. Because the ability for a woman to plan her family is important to her health, it is important to her career, and it is important to the economic well-being of her family. This bill is unfair. A woman works for a company and she receives benefits. A man works for a company and he receives benefits of that employment. To deny a benefit for a woman for something that is especially and particularly important to her health is discrimination. Women do not need the men in this chamber upstairs to tell them what to do about their health care and their bodies. Thank you.
I am Tishaura Jones. I'm the Assistant Minority Floor Leader and State Representative of the 63rd District. You've received misinformation regarding Senate Bill 749. People think that Senate Bill 749 says that no one should be forced to pay for abortions in their health care plans when it violates their most sacred moral or religious beliefs. Missouri law already provides or prevents any employer or individual or self-insured from having to pay for contraception when it's contrary to their moral or religious belief. It also provides an exception to the requirement to provide coverage for contraceptions. Similarly, with regard to abortion, a person, healthcare provider, insurance provider, or any business which has a religious or moral belief or objection to abortion may not be forced to provide or pay for or provide for abortion. A healthcare provider's right to refuse to provide abortion services is further protected by the law. So what's the meaning of this bill? What is it here for? I am dismayed that there are political voices claiming that Senate Bill 749 is somehow required to protect religious liberty. This is false. Senate Bill 749 adds nothing to the protections now afforded to every Missourian, every church, every healthcare provider who wishes to be free or from forced to being paid to pay for abortion or contraception. There is no religious liberty issue here. The entire campaign is a political exercise. It's a restatement of current law for political purposes, and I'm not willing to duplicate the law. This bill makes one change to the law, and it gives insurers more power to decide what I do with my body, and I'm not willing to participate in that. I took an oath to protect the Missouri Constitution, and I will do that, but I will not participate in a political exercise that would prevent me from having access to birth control or prevent any woman from deciding what to do with her body. Senate Bill 749 should be sustained, and you are looking at people in this caucus that will do that. Thank you very much.
I'm State Representative Sarah Lampe from Springfield, District 138. Senate Bill 749 invites insurance companies to intrude upon deeply personal and what should be private decisions about contraception. It gives insurance companies the power to restrict access to contraception, even if employers and their employees want it. For more than a decade, Missouri law has provided strong religious and moral protections to safeguard the beliefs of employees and employers regarding contraceptive coverage. The protections apply whether an employer is a church or religious organization or not. Employees and employers can opt out of providing or receiving contraceptive coverage if it conflicts with their religious moral convictions. At the same time, current law acknowledges the rights of women and families who want to access contraception. What we have in Senate Bill 749 is just as Representative Jones mentioned. It's a political exercise as a part of a war on women. It is bringing forward again an issue that is perceived as being a wedge issue, when in reality it's about basic health care. Senate Bill 749 shifts decision-making authority about access to contraceptive coverage away from Missouri women and families and employers and into the hands of insurance companies. This could set a dangerous precedent for the denial of other kinds of health care in the future. If this Missouri Republican-led legislative body want to stop this war on women, they must get back in touch with the real lives of 21st century women. And the fact that it is quite contrary to what they say every day and have for the last 8 years that I've been in this chamber. And that is they want smaller government. And yet we're intruding on the personal lives of women. I ask that we work hard, stand together, and sustain the governor's veto.